Hi, I'm Dr. Tenner of the Goldberg Tenner Clinic, where we reverse chronic disease with our patients. And acid reflux is a very common health problem people come to see us with. It's also known as gastroesophageal reflux disease. It's a very common problem in our population. And I was at Costco the other day, and on my way out to the checkout, I turned a corner, and there's almost this sea of Nexium, which is an acid-reducing medication, just like a mountain of it right there in front of me that Costco was promoting. And I was a little surprised at how much shelf space that Costco devoted to it. And then I thought to myself, probably shouldn't be surprised with the amount of people that are suffering with this type of problem. Costco must be moving that stuff pretty quickly. And so very common medication that people take: Prilosec, Nexium, Tums, Meprazole. Some of these are over the counter. Some are prescribed by medical physicians, including gastroenterologists. And we've seen people on them for sometimes years and decades. Interestingly, if you look at the box, it'll say on there for the medication, it usually says, do not take this medication more than 14 days, at least without the approval of your medical physician. But like I said, we've seen people on it for years and sometimes decades. Most people are not aware of the significant problems that can arise when you take these drugs, particularly long term. Dr. Goldberg and I spend a lot of time talking with our patients, the ones that are taking these drugs, helping them understand what those ramifications are and work with them to solve their acid reflux problems so they're not dependent on these drugs. There are several things that are very important to be aware of. The first thing to understand is that with acid reflux, the problem is not stomach acid. Okay, stomach acid is a very critical, very important component of the digestive assembly line. All right, it's involved in a number of different important functions, and when you neutralize it or interfere with its production by taking one of those medications, it's going to create significant physiological disturbance. Stomach acid is absolutely critical for digesting food, particularly the proteins that you consume. If food is not digested well, it will poison you. Okay, contribute to indigestion, symptoms of indigestion like gas and bloating. And interestingly enough, when you get further indigestion from taking those medications, it's going to create pressure in the upper portion of the intestinal tract, cause more acid to spill up into the esophagus, and create more reflux, for which the patient then takes more acid-reducing medications. So it becomes this vicious cycle. But when food's not digested well, it creates poisoning toxins in the GI tract as a result of bacterial decomposition. And that increases the tendency for allergy, skin eruptions, digestive issues, further digestive issues, perhaps inflammatory bowel disease, autoimmune problems, joint pain, arthritis, fatigue, headaches. I can make the case that interfering with stomach acid can contribute to virtually any type of symptom. So again, if you take acid-reducing drugs, you are pretty much guaranteed to have bad digestion, and bad digestion is going to result in other systemic health issues. The second thing that's real important to understand is that stomach acid is involved in making the minerals that you consume with your food soluble so that you can absorb them. These would be things like calcium, magnesium, iron. So if your acid's been neutralized or interfered with in any way, you will not absorb those minerals well. That can contribute to things like anemia or osteoporosis or magnesium deficiency, which then has further health ramifications. You also won't absorb B12 as well, and so B12 deficiency is another problem commonly associated with long-term acid-blocking medications. The third thing that stomach acid is involved with is in killing off any invaders that come down with your food, pathogens like bacteria and even perhaps parasites. God gave you stomach acid for a reason. It serves as a protective barrier against those invaders. So if your stomach acid's been neutralized, bacteria, potentially parasites and other pathogens make their way down through the stomach where they would normally get neutralized by that acid and can get down into your intestine, into your system, and create problems. Now, that's not to say that acid reflux should not be addressed. It certainly should be. We just find that taking acid-reducing medications is not the best way to approach that problem, and often leads to development of other issues. And so the best way to address this problem is not to simply suppress the acid, but to rather identify the reasons why the reflux is occurring. And there can be many reasons depending on the case. You can take 10 people with acid reflux and you may have 10 different reasons why each person has it. So the process by which we would work with a patient is to sit down with them, get a good thorough history, start dissecting out the reasons why this problem is occurring, do a physical exam, and then get the right lab work to further narrow those factors down. So we can develop an action plan, a biohygienic program, individualized to the patient to address those specific reasons, and then get the patient doing the right thing, not taking more things that will interfere with function and have side effects, but to do the right thing so that function starts to normalize, so that the right amount of acid is produced, that acid stays in the stomach where it's supposed to be. It's not spilling up into the esophagus, giving that patient a lot of heartburn, but serving its normal physiological role so that food can be digested well, so that minerals can get absorbed properly, so that the body has a good protective barrier against pathogens and invaders, so that the person can start to thrive and their health can return. They not be plagued by this ongoing acid burning in their chest and the side effects that are produced by these types of medications. And there are many examples of success stories on our website for patients who have been on this stuff for sometimes years and decades, who have been able to get off of it and get well. Again, not by treating symptoms, but by identifying causes, addressing them, and then recreating health by getting them doing the right thing.